stuff in here is review. So it's going to build, basically you're building the information, the knowledge throughout the course. So don't be surprised if on the final, there are things about blood pressure. There are things about cholesterol. There are things about fats and different types of fats. Like going back to the beginning of the course, because everything we've talked about has built on that, right? And this is really just chronic diseases. Some of the last ones we're going to go over, and you guys touched on yesterday, stress and disease, and then healthy mind, body, spirit at the very end. I put the page numbers in here, right, so you could go right in the text. This is where I got most, not all of the information, because some of it I add and I have from recent research and other things, but for the most part, that's where you can find it. Autoimmune disease, I'm not going to talk about. Dr. Field's lecture, phenomenal. She talked about all that stuff from a personal and professional perspective. Heart disease, cancer, diabetes, stroke. Those are chronic health conditions that really affect women. 40 to 80% of those are actually due to lifestyle choices and factors, changeable factors. These are estimates based on different studies and how much of these components affect these different chronic diseases. And of course, autoimmune diseases are different than this. This is not just lifestyle choices factors. Autoimmune diseases often come down to overactive immune system, right? And genetics and the X chromosome and all those things. That's why 80% of women have them. So this is real focusing on some of these other ones. So they affect the poor and the middle class more than the wealthy. Okay, I'm going to say that again. These chronic diseases affect the poor and the middle class more than the wealthy. So you might have the idea in mind, you know, the rich white man, he's having a heart attack and then has a stroke, and that's actually not the most common scenario. These affect females and the middle class and poor more than they do the very wealthy. Why? Why would that be? Lack of health care?
Yeah, I was going to say the white man can go and pay whatever
money.
he needs to.
Right, money, so endless money. Yeah, Julia.
More work and more stress.
More work and more stress.
Geographic location.
Geographic location where you're at, access to healthcare. Okay, what else?
Yeah, I was going to add access in food deserts.
Food deserts, access.
Takes a longer time to get help.
Longer to get help, yep. And what about cost of food? Types of food you can get with the amount of money you have, right? So access to good, nutritious food, that is more expensive, it's more costly, right? So that directly links into diet, nutrition, body weight, and some of these other risk factors, right? So those all play in together. Oh, I skipped that. Heart disease is the leading cause of death. I've already talked about this, and we had a whole heart lab, right? Leading cause of death, not just in the United States, but worldwide. Every 3 deaths, 1 of them is due to cardiovascular disease. More than any other cause of human mortality, okay? Super, super high. And notice, over half of those causes, based on the research studies, are preventable. And I will tell you as an anatomist and a physiologist, the heart muscle tissue is amazingly resilient. It's strong, it's tough, it's resistant to most infections. It will keep beating your entire life, starting at week 4 in the embryo, all the way up till you're 70, 80, 90 years old. That thing has a lifespan, it just pumps about once every second. It's really, really tough. But the other extraneous factors that you take in or you're exposed to, or your lifestyle factors, will take a great toll on the heart and can disease the heart and result in all kinds of problems. So naturally, you think, oh, humans just have kind of weak hearts. We don't. Our hearts are very strong. It's one of the most sort of robust, strong organs and organ systems within the human body. The brain and the heart, very, very tough and resilient. Heart disease is a whole category of conditions, and you guys talked about it in your presentation yesterday. It affects the vessels or the structure of the heart, the electrical conduction of the heart, blood clots, anything to do with the structure, the anatomy, the physiology, or the blood vessels of the heart. Coronary heart disease and atherosclerosis, or hardening of the arteries, where plaques build up in those arteries that serve the heart. These little coronary arteries right here, it's called CHD, that's very common. Hypertension, high blood pressure, congestive heart failure, congenital heart defects, heart valve disease, mitral valve prolapse. What does that sound like? Mitral valve prolapse. Prolapse is when something goes out the other way, right? So instead of the valve cusps that separate the atria and ventricles going down and opening and letting the blood go through, this prolapse will actually open up and go the wrong way, so that blood will backflow. It won't continue to go in sequence through the heart. That can be really, really dangerous. ultimately can lead to congestive heart failure and cardiovascular heart attack. Angina pectoris, and it was talked about yesterday, right? This is chest pain due to ischemia. So angina pectoris is pain in the chest. It feels like a tightening or squeezing in the chest. That does not mean the person is having a heart attack. However, it should be taken seriously if that happens, and you should go to a medical provider immediately. Typically, this will happen a lot, and it's not a heart attack, but it's indicative of a potential heart disease problem and an impending heart attack, okay? So ischemia is lack of oxygen and blood to a particular area of the heart. It'll cause pain. So this is like an early warning sign. Ooh, chest pain. Ugh, that's uncomfortable. Okay, heart tissue is having some issue. Myocardial infarction, or MI, if you watch medical shows, they say they're having an MI. Myocardial infarction. That means a specific area of the tissue of the heart, typically in the ventricles, the big pumping part of the heart, did not get enough blood and oxygen. It was severely ischemic, and now that area of muscle is not pumping effectively. It's not contracting, so the heart is crippled, right? So it can't effectively beat the way it's supposed to. We call that a heart attack. We also have arrhythmias. These are just electrical conduction problems, so they're irregular contracting of the heart. There's something irregular going on. The heart is too fast, the heart is too slow, it has an aberrant sound or structural problem with it where it's not electrically conducting the right way. What can I put you up to and see if you had almost any of these things happening? An EKG, an electrocardiogram, right? ECG or EKG. Endocarditis is an internal infection usually caused by bacteria. It affects the internal parts and chambers of the heart, including the valves. That can be really bad as well. This is demonstrating atherosclerosis, the buildup of plaques. So fat, cholesterol, platelets, white blood cells, they're involved in the immune system. They all start to pack into that area. And this begins early in life, even in the first decade of life. When you're 10 years old, the way that you eat, the fats you consume, if you eat a lot of saturated fats, if you eat a lot of trans fats, it starts to build up and this plaque starts to deposit in certain areas of the arteries, even the coronary arteries on the heart. And over time, by the time someone reaches their 30s, 40s, 50s, if this has gone and continued, it's the body trying to sort of, in an inflammation response, pack up or fix a problem. But it actually, in a fetal cycle, makes the problem worse. So what happens is this ends up occluding the blood vessel and blocking blood flow to a certain area of the heart or the brain, okay? So plaques, which are basically fat and white blood cells and cholesterol and everything all packed at that area, can actually lead to life-threatening heart disease. Specifically, I would say that one is atherosclerosis. Did you have a question about that, Christina?
Well, I had a question about the ischemia. So the chest pain, is that easily mistaken for just heartburn? Or would that be?
Yes, it is. And that's a good point. We'll talk about that. Many times women especially, so females that are having that chest pain, will think it's just heartburn or gastrointestinal, something they ate, something they're burning, and it's part of that process. So yeah, that's a good point. We'll talk about that more in a second. So heart disease, historically not studied in women. Not really until the 1990s, because doctors, clinicians, researchers were afraid to do studies on women that involved the heart and hormones and different things, on women that were in their reproductive years, right? Or in their 30s, 40s, 50s. They didn't want to do that. They just thought, ooh, if there's a chance that the woman gets pregnant while they're on the study and part of these clinical trials. Plus, I will say that's the scientific sort of, well, women weren't included, they were worried about this or that. But honestly, it was very male-focused. Almost all research was very male-focused. It was like, oh, look, heart attacks, they happen in men, let's figure out why. So all the studies really focused on males, not on females. Tell about landmark studies looking at heart disease in women and the Framingham heart study that started in the 90s. So it was mistakenly concluded women don't suffer from heart disease. Completely wrong, right? We know that now. You guys talked about it in the presentation yesterday. Now we know women are affected. They just developed it about 10 years later on average than males do. Today, more women than men ultimately die from heart disease. Certain types of heart disease, not all in that whole category. Some men are higher levels, but especially like coronary heart disease or CVD, more women actually die of that, just later in life, okay? So they have sort of protective effects. It doesn't affect them until later. We're going to talk about how estrogen is involved in that. Women also have a longer lifespan, so they live longer period of time, right? So they're exposed to some of this disease state later in life than males are. And women have different symptoms from men, more likely to push through the pain and delay seeking medical treatment. Like Christina just brought up, is it mistaken for heartburn? Yes. Many women will just go, I have heartburn, I have acid reflux, my jaw's hurting. Right now I have a stiff neck. Going on like 3 days, it's a tension, stress related neck problem. But things like that in the neck and the chest, often women will just go, you know what, it's stress, it's not my age, I got stuff to do. So whatever. And so it ends up being more fatal because it's not taken seriously even by the woman, right? Does that make sense? So a lot of that results in some of these fatality results. So what are the symptoms of heart attack in females versus males? We went over this in lab when we did our heart lab, right? And they're not always, not for every woman, they're the same. It's like, just like for males, they're not all the same. But in general, there's some key differences when it comes to a female having a myocardial infarction versus a male. And what is something? Do you remember?
For men, they feel it in the arm.
Right, men it's much more down the left arm, yeah. Bobby, jaw, yeah. A lot of women will feel it up in the jaw, almost like acid reflux or pain in the jaw, like discomfort up in the neck, especially the left side. What else? Were you going to say something? That was it? Okay, yeah. So it's in the chest, it's tightening in the chest, it's up in the neck, it's even progressive sometimes up into the jaw, especially the left side. But it's not that standard like you see where there's tingling and numbness and the whole left arm is, that's not a really common symptom in females. They can have that, these other chest, face, neck, myofascial sort of pain, and up high in the neck is more typical. Okay, oops. Just to show you, I know you guys are not doctors, but you've actually learned how to use a lot of equipment that doctors use and that medical professionals use, and that's the EKG. You can hook somebody up by electrodes, so little electrode pads with the electrode recording, current recorders, hook them up to the EKG. You can use the old-fashioned analog box or nice new electrical digital one that plugs into a machine and you watch it, right? You can see it right on a screen. I like the paper ones because you can look at them and analyze them and see what's going on. These are examples of arrhythmias, so conduction problems, variations away from the normal sinus rhythm. And you guys remember all the little normal sinus rhythm? If we had to label them, you remember we got the one way that goes like this, and then we got the one way that goes like this, and then another one? What's that one?
The love dub.
P. The love dub is the sounds of the valves closing. That's not this. This is the electrical conduction spreading through the pacemaker and down the heart and allowing it to fire action potentials. P, Q, R,
S,
there you go. And they represent the atria depolarizing, the ventricles depolarizing, good job, and then the ventricles repolarizing. If you ever go to a cardiologist and they're talking about your EKG or you have a heart murmur, these things are common. Or when your parents or siblings or someone, you will be able to know a little bit. You'll be able to interpret. Actually, even just the knowledge you guys have now, you will impress any doctor because most people have no idea. They come in there, they're like, yeah, what's that? I have no idea. So this actually gives clinicians a lot of information. This is bradycardia. This means slowing of the heart. And anytime you have a slowing of the heart that's under about 50 or 60, that's considered bradycardia. That could be a problem. Sinus tachycardia, this is a very high. So this is usually less than 60 beats per minute. And notice some people, athletes, will have already around there. They already have low because their heart is very efficient and strong. Tachycardia is greater than 100 beats per minute. And this is, we're talking rest, not exercise. We all get above there during exercise. This is rest-induced tachycardia. There's something happening with the conduction system of the heart. It should not be going that fast. Drugs can do this. Different heart disease problems can do this. Ventricular fibrillation, this means where the ventricles are not conducting in sequence, contracting at the same time together. They're having a conduction problem and they're just like flopping. They're fibrillating. This is really, really bad, right? This is where in a hospital setting or out, if somebody has defibrillators, electrically shocking the individual is necessary to zap the pacemaker and cause the whole conduction electrical system to get back on synchrony again and start firing the right way. The ventricles are just like doing their own thing. They're not responding to the connections coming down from the atria, from the pacemaker. So that's really serious. This requires, you ever see on a medical show, they say defib stat? That means get the defibrillators, give them electrical current immediately, zap them to allow the heart to start going back to its normal rhythm. Ventricular tachycardia, that's where the ventricles are just beating way crazy out of whack, super fast. And they're not listening to the atria, but they're still in a coordinated beat. These are not coordinated. This can result in death. Myocardial infarction or an MI, a heart attack, typically on an EKG, clinician can pick this up, or a cardiologist, just by putting a person on the EKG. If there is an elevated ST segment, where it stays up instead of coming back down and doing the normal repolarization of the ventricles, contracting and relaxing, that usually indicates an MI. So you can see it right away. Oh, there it is. You've had one or you're currently having one. So those are all just kind of hands-on ways that we can look at the EKG and what they mean for heart disease. All right, risk factors for heart disease. A lot of these we've already talked about, we've learned about. Older age, so the older you get, the greater your risk is. These are uncontrollable or unchangeable factors. I can't control that I'm getting older and I'm getting more in these risk categories for these different things, right? Family history, can't control that either. Do you have it in primary relatives or directly in your family? Race and gender, and we're going to talk about those more in just a minute. Controllable factors are things like whether you smoke. Do you have hypertension? Sometimes this is not controllable, but oftentimes it is. Hypertension, high cholesterol, high body fat or a high BMI, physical inactivity, type 2 diabetes. Almost all of these have a measure of control that can be changed to sort of eliminate this risk or decrease these risks. Contributing factors are menopause, estradiol loss, OCPs. So I will say oral contraceptive pills, as you guys presented yesterday too, they do carry some risk for blood clots and heart disease, especially if you are a smoker and you have a family history of deep vein thrombosis or blood clots or heart disease. You should not be taking OCPs or if you were in those risk factors and if you smoke, because you're